January is Glaucoma Awareness Month, and glaucoma is the leading cause of irreversible blindness. Now, more than 3 million people in the United States have glaucoma. The National Eye Institute projects this number will reach 4.2 million by 2030, which is in 7 years, which is a 58% increase. Joining us now to tell more details, we've got the optometrist at Pelham Parkway Vision Center, Dr. Diana Ilyasova. And Dr. Ilyasova, thank you for joining us. And when we look at these numbers, it's kind of scary when you say by the year 2030 that we will see a projected 58% increase.
Sounds about right. We have found more ways to diagnose glaucoma. So, as technology arises and medical understanding arises, we do find that many people have glaucoma.
And when we talk about having it, some people wait before the diagnosis comes, and some people it becomes too late. But that's why we're here today. We're talking because it's a Glaucoma Awareness Month. So let's make our viewers aware as to how exactly do we define glaucoma.
Well, the true definition of glaucoma is slow optic nerve damage. So the optic nerve is a nerve that connects your eyeball to the back of your brain. So this optic nerve begins to slowly atrophy or slowly degenerate, and when it completely degenerates, one can become blind.
And I understand that the glaucoma does come in different forms. For someone that's out there, how are we able to differentiate the different types of glaucoma?
The most common type of glaucoma is an open angle glaucoma. Open angle glaucoma means there is still space for the fluid to move around in your eye. You just have more or less high pressure, but the fluid is able to move. That's the kind of glaucoma we're talking about most commonly. There is another type of glaucoma called angle closure glaucoma, and that's pretty rare. And it's usually a medical emergency. That's when the fluid might be producing correctly, but it's not leaving the eye fast enough due to obstruction, or we call an angle closing, and the fluid is obstructed and it can't move in the out from the eye, and you have a very high eye pressure.
We hear a lot about eye pressure. Give us some insight here. Will you talk to me about it because there's a normal eye pressure, I guess, and what causes
Yes.
eye pressure to vacillate?
Okay. So it's we're still not sure why some people have this problem where the pressure starts being accumulated in the eye. Okay, we do know that glaucoma has a very high hereditary risk there. So at some point in your life, the fluid starts accumulating in the eye a lot, and this causes high eye pressure. When we talk about glaucoma, we almost anonymously talk about high eye pressure. It's a risk factor for glaucoma. So when the pressure rises in the eye, it atrophies the back where the optic nerve is. And this is how they're correlated. So the pressure rises, it ends up atrophying slowly the nerve, and then it's a slow progression, but the progress continues.
If someone's out there asking the question about symptoms, how do we diagnose what the proper symptoms are when it comes to this?
Well, that's the problem with glaucoma. It comes with no symptoms practically, except for angle closure glaucoma. That's when I mentioned it's a medical emergency. Most of glaucoma, primary open angle glaucoma, there are no real symptoms. You don't come in holding your eye in pain. You can have occasionally very like red eye. You can have some kind of pressure. You can have colored halos in your view, but more or less, it's almost always shocking for a patient because they come symptom free, and then I have to diagnose them glaucoma. There's like they're not understanding, but I don't feel like I have glaucoma. I don't have pain. I never suffer. So that's the sad part about glaucoma. We actually don't have symptoms.
Yeah. As we look at the numbers, can you tell us who do you find to be a predominant risk when we look at glaucoma because there are some demographics that stick out more than others.
Yes, well, I'll tell you, glaucoma is prevalent all over the world. It's all over the world, but there are some demographics that have more glaucoma than others. Um, Very heavily in Latin Americans, Caribbean Americans, Caribbean countries have very high prevalence. Uh, Also very prevalent in Africa. In Eastern Europe, you have other forms of glaucoma. There are other subtypes of glaucoma. In Eastern Europe, we call them usually pseudo-exfoliative or pigmentary glaucoma. It's very common in Europe, that kind of glaucoma.
And as I look around, I see so many people are now becoming more and more aware of glaucoma. We're talking about uh, this eye challenge that many people are really struggling with today. But for yourself, the work that you're doing over at the Pelham Parkway Vision Center, talk to us about how many people you're seeing and what's it been like for you.
I feel like I'm in like this beautiful spot of bronze, and I get all kinds of people, and but primarily my patients are from Latin descent and African Americans, and which is very high prevalence of glaucoma. I feel like I speak about glaucoma all day long. Uh, I know it's not like this everywhere, but wherever I am in Pelham Parkway, glaucoma is pretty prevalent. And I'm fortunate to have great medical devices and many ways to spot the disease earlier.
Well, I know that exams are key and critical, and sometimes we don't make our necessary trip to the optometrist the way that we should. How often should a person go over to the optometrist, getting their look uh, and seeing how things are going?
Yes, I always say you should please check your vision once every 2 years, even though if you don't need glasses. Because there are things we check, such as glaucoma, which we do normally take pressures on everyone, such as glaucoma that we can spot. And it doesn't have to be correlated with bad vision. People with good vision can also have glaucoma. So eye exams are very important. If you're a very healthy adult, once every year, once every 2 years stretch, but not more than that.
What about children? How much are they at risk when we talk about glaucoma?
So kids can also have glaucoma. We call juvenile glaucoma very rare. So most of the time, glaucoma is prevalent over 40. Children are at the lowest risk. I do see very few occasions that I can spot a child who has glaucoma. I think more than 10 kids in my mind right now that I'm currently following them for glaucoma, but in general, they're very low risk.
I want to look at a statistic that says, a 58% increase by 2030. That's what we're looking at out there. Um, and it's 6 to 8 more times prevalent in African Americans and Caucasians. But the sad part is 40% of people, uh, as many as 40% of people, can lose their vision without a person noticing.
Yes, that's the issue. There's no symptoms. And the way you lose vision, it's not in front. So you're not noticing cloudy vision. The way you start losing vision is at the periphery first. So slowly, maturely, without you noticing, your periphery starts declining. And it can go like this. Your periphery starts declining. It is so slow that the person doesn't wake up realizing he's not seeing peripheral vision. But, since it's progressive and slow, by the time they realize that they're not seeing so well, that's already like advanced stage of glaucoma, and the vision that's lost, unfortunately, cannot be regained.
Yeah.
I cannot revive the cells. The cells in the optic nerves are done. So unfortunately, that's why it's very important to get eye exams. Unfortunately, you don't have symptoms, and some people do walk into my clinic a little bit too late, and I have to tell them that I can't recover that vision that was lost.
Well, that's why we got you here talking about this, Dr. Ilyasova. As this is January is Glaucoma Awareness Month, and that's what we did. We actually raised the awareness here on this show. So thank you so much for being with us, and hopefully somebody will take advantage of going ahead and getting that eye exam and doing that preventive maintenance is what we call it.
Absolutely. Very important. And thank you for spreading awareness.
No,
Especially
we're glad we can. I want to let our viewers know now, if you want more information, guess what? Visit the website at PelhamParkwayVisionCenter.com. Again, that's PelhamParkwayVisionCenter.com, and you can be scheduled for an exam. We encourage you don't go anywhere. We do have more open coming up right after this.